Hello and welcome everybody to today's webinar with Dr. Igor Kozak from Moorfields Eye Hospital in Abu Dhabi about teleguidance of navigated laser. I am very proud of today's topic and also the way how we will do this webinar. It's something probably much different from what you are used to. We are now going to present remote capabilities around the laser. I welcome warmly Dr. Kozak, and I hope you will enjoy the webinar a lot. During the webinar, Igor will first present the remote capabilities, the teleguidance capabilities of navigated lasers. Thereafter, you have the ability to ask questions at any time. To type in and send your questions, please use the question window of the webinar application. Type in your questions. If there are any questions remaining that cannot be fully covered in today's webinar, these questions will be answered offline after the webinar. Nothing will be missed from your questions. Igor, thank you very much for being available for us today. And I would like to hand over to your presentation now.
Thank you, Ulrike. It's a pleasure to present this talk and moreover to be part of this fascinating technology which actually can connect people at various distances, which we find out to be so important in these difficult times. Laser photocoagulation still has a significant role in treatment of numerous retinovascular diseases. It can be either a primary treatment for some of them, or it can be a useful adjunct as a combination therapy along with other treatments such as anti-angiogenic therapy or others. First of all, there is a lack of expertise in some parts of the world, and we are well aware of increasingly rising numbers of diabetes globally and diabetic retinopathy along with diabetic macular edema. This increase in numbers is overwhelming and overwhelms capacity of medical expertise in some parts of the world. And indeed, some countries do have lack of expertise in certain procedures such as retinal photocoagulation. So it is very important how to use expert resources efficiently and moreover how to make them available to where they are needed. Another challenge is in learning the laser photocoagulation and in educating of young physicians how to safely perform laser photocoagulation. There is basically no appropriate training module. And as I mentioned, these times are very difficult because pandemics has restricted travels and meetings and interchange, and also has significantly reduced number of patients allowed in clinics and number of sessions that these patients can return to. So for that reason, there is a system actually which can be implemented to use distant learning, how to perform retinal photocoagulation, its various types. And there is a model that we hope to be useful in educating either young physician or general ophthalmologist to learn to perform retinal photocoagulation in a correct way. So while developing this education, we are familiar with the common shortcomings and challenges of learning, such as many people in the laser room along with a patient, and then only certain number of them being allowed to either have hands-on experience or use a teaching scope to actually see what is happening during the treatment and which is the correct way to perform treatment. So the trainee should learn about tissue interaction and about basic physics of retinal photocoagulation, such as spacing and expansion of laser scars. And when we finally get to a point that a trainee physician, our student, will actually perform their first treatments, there is no safety net. And not always there is a senior colleague available to guide novice physician in performing these very important and very accurate treatments. So, in summary, there are numerous challenges to retinal photocoagulation, and that they include lack of experts who are available for treatments or for teaching, then lack of safety measures for laser training, and also little efficiency in current education process. And all this again multiplied by the limitation imposed by COVID-19 pandemics. So the question we pose is, can a digital laser system help to overcome all these challenges? So navigated retinal photocoagulation has been in practice for nearly a decade and has been very successful in many fronts. There is a sequence of steps to perform navigated laser photocoagulation. That starts with acquiring imaging of patient's retina and creating a treatment plan on these images. We move on to treatment phase in which a live image is guided by pre-planned platform, and the treatment is carried on with eye tracking performed at the same time. So all the pre-planned points are delivered to the area where they need to be delivered. All that, of course, is documented and can be analyzed at the end of treatment session with a summary of number of spots and the energy used, spot size used, and duration of each laser application. This will become very handy for future reference. We have to mention that this is, of course, non-contact system, so there is no contact to the patient's cornea, therefore the treatment is very ergonomic for physician, therefore, and more comfortable for patient. There is a relatively large working distance between a physician and patient, which again becomes very useful in COVID times. And the equipment is comparable with any personal safety equipment, any barrier additional that we have to use to prevent the spread of face-to-face infection. The steps outlined in the navigated retinal photocoagulation can actually be carried out with two experts not being at the same place. The concept of teleretinal photocoagulation has actually been tried and has shown to work very well, in which one center acquired images on a live patient, and then these images were sent to an expert at another distant site who performed planning, and then this plan was carried out at the initial site. So there was communication between these two centers, and basically the center one performed the photocoagulation based on recommendations of center two. So because we can perform this photocoagulation using the expert at a different site, we also looked into the ability of distant learning, how to teach retinal photocoagulation if you cannot be at the same room with your students. which includes that the treatments can be observed by students at any point of time from any place in the world. And they can also perform these practice exercises and create treatment plans, which then educator or a professor can discuss and analyze how to improve the performance. So actually we have multiple opportunities to practice planning, which is an important part of laser photocoagulation. And the concept that this can be consulted and taught over the distance is very new. Also, constant availability for challenging cases by not having the need to be at the same time in the same room with the consultant gives ample opportunities for the system to be an excellent educational tool for anyone who needs to perform or needs to learn about safe laser photocoagulation. So let us review in practice how this can be realized using the feature of navigated system Navilas. There is a possibility of distant learning about the system, about the pathology. Then there is ability to do distant planning, where a person is at a distant location and performs an accurate planning. Then there is distant guidance, where a consultant can actually help in planning the treatment algorithm for the trainee physician. Or we can use only consultancy, after which each party can independently work on their part to finally arrive at the goal, and that means successful treatment. The videos used for these treatments show retinal images with no pathologies because these are treatments for demonstration purposes only. So let us use a practical example. So the first ability of this system is distant learning, and that means that we have an expert physician who is performing photocoagulation and treatment himself. At this point, physician is allowing remote observation, and this is the screen that the students are seeing. They log on to that with a particular ID given to them. Physician, as such, is in control of who is watching the treatment and can allow not only one room of students to watch and his photocoagulation, it can be transmitted to multiple rooms. Of course, it is ID protected access. And this is in practicality what it looks like. We have a treatment site with the Navila system. We have a physician, and then we have a patient. At the same time, we have a class at a distance place who are following the experts performing the treatment. So this is online teaching, and the expert is acquiring images and aligning images to create a treatment plan. The students can see all this alive, can take notes. This can be done from classroom. This can be done from any practice room. Image of physician himself is an optional. Most of the information, of course, is coming from the monitor, which follows the treatment photocoagulation. Patient is aligned, and live photocoagulation can begin. The students can watch energy settings and power settings, and are basically in alignment with everything that is happening in the treatment room. So this is a unique opportunity for them to see a laser photocoagulation protocol. And actually, based on this can be used as a way to examine students. So here we can see that the treatment is now complete, and the physician is basically presenting a completed treatment plan with all the parameters that have been used for the treatments, and then the discussion can go along among students or with professor afterwards. In the outline didactic process, we will now move on to the second step, and that is distant planning. So let us review in practicality how we can do distant planning using Navila system. In the second case scenario, we have an expert at a distant place, and we have a trainee allowing the expert remote access with a protected ID. And in this scenario, the consultant will be creating treatment plans at a distant site, and this will be executed by a student who is in the room with the patient. So here we can see granting them access. At the end of the session, the consultant can safely log out so that there is controlled access to these treatment sessions. And here we can see trainee acquiring images of the retina. This is a wide angle image for treatment in retinal periphery. Now the expert who has a remote access will create the treatment plan. Here we can see the protective no-fly zones, and the plan will include treatment of the retinal periphery. So this is again done by an expert at a distant location. Once that is complete, the trainee will upload it on a live image and will execute the plan. This is under direct observation of consultant. Once that is completed, the system will again give us information about details of the treatment. And once that is reviewed, the access is terminated. So the next module that this educational platform allows is so-called distant guidance. And let us review in practicality what is meant by distant guidance. In distant guidance, we have the trainee physician who will be performing both treatment planning and photocoagulation itself. This is in conjunction with the observation by a consultant at a distant site, but the trainee is performing all these steps. So first, after acquisition of images, the trainee is showing treatment no flying zones as an extra safety net, and then selects areas and spot sizes to be used for photocoagulation. The expert at this point may intervene with the mouse control to make sure that all these placement of future laser applications are safe and necessary. And once that is agreed on both sides, we proceed with photocoagulation performed by the trainee physician, again under observation. After completion of the treatment, we get detailed report of the photocoagulation. So Navigate is another platform that serves for physicians to practice their treatment planning of various retinal pathologies, and it's a collection of cases where they can practice treatment plan, but they can also share their cases with other colleagues. That all facilitates the education. It expands database for training purposes that are available, and eventually we want to assure that after high quality education, the users of this platform can perform high quality treatments. This platform is now running on iPad, and after downloading it, we have access to this wonderful sharing platform, which can be used for teaching purposes. So finally, we get to the last step of our didactic process using distant learning with remote access with Navila system, and that is consultancy only. We can also use the same system to consult with our colleagues and ask for second opinions. We can transmit and share these images. We do encounter cases where we like to have a second opinion. These are usually cases of non-responders after numerous treatments or repeated treatments, either with retinal photocoagulation or other adjunct modes of therapy. And so we can safely use this platform to perform this distance consulting with colleagues that we deem appropriate. So in summary, we are aware of common challenges in ophthalmology, which are additionally enhanced by pandemic of COVID-19. Remote access can be a solution to some of them. With remote access, we have options that we can teach students or general ophthalmologists who want to learn retinal photocoagulation even on a distant site. Distant learning system can also serve as an examining tool for students to make sure that they have understood all principles of treatment planning and its safety, and that they can employ these in creating safe treatment plans. We can assure that experts guide these physicians without being in the room. Experts can pre-plan treatments if they cannot access the clinic or want to make the process more efficient. Experts can also consult users in other locations and other experts in other parts of the world. And this is all technologically possible because of navigated photocoagulator Navilas. And we know that this is a fully fledged laser treatment system that supports in social distancing, which is so critical in these times, and is an ideal platform for distance learning and distance planning, as we have seen by showing you these concepts. Therefore, the applicability of navigated photocoagulation has been expanded. It's technology of the future. And with that, I would like to conclude my talk, and thank you very much for your kind attention.
Thank you very much, Dr. Kozak, for this very detailed and in-depth presentation. I think there had been a lot of details included. There might have been questions already arising. Please feel free to add that. Before we jump to the question and answer session, I would just like to do some, let's say, closing remarks for this remote access options for Navilas. These remote access options are available for the Navilas 577 S, which includes the Pro as well as the Prime version. These features are at the moment in validation, so they are not yet for sales. If you anyhow would like to have more in-depth information or request a virtual demo, we are very happy to provide that to you, and please book an appointment via our online calendar. You see the link down here in the presentation at the moment. We can also provide that to you afterwards in a short mail. Yes, I would think we can move ahead to the question and answer part of our today's webinar. Now we also see Dr. Kozak. Just as a reminder, if you want to ask questions, to type in and send your questions, please use the question window of the webinar application. Type in your question in the panel and we will see it and forward to Dr. Kozak. If there are any questions that we cannot cover today, we will do that afterwards offline. And I already see the first questions, Dr. Kozak. Are you ready for taking the first one?
Yes, please.
Okay. So the first question refers to the liability if one doctor plans remotely being off-site and the other one is executing the treatment. Who will be going to sign the treatment report?
Yeah, that is a very good and important question. So it is always the treating physician who is responsible and therefore liable for any treatment and following hands-on interaction with the patient. So it is always the physicians executing treatment who needs to sign informed consent and then prepare a report.
Thank you. I think that was a concise answer. Let us already move to the next question. During your presentation, you mentioned at least twice, I think, the exam capabilities. How exactly would you think to use these remote access options for student examination purposes?
Okay, so when we look back into how we were taught actually laser photocoagulation, there is a huge variety. So there is very little uniformity of how medical students or young ophthalmology residents are being taught. And it's usually we get some theoretical knowledge from articles and books, and then we consult our physician, and then we are allowed to sort of start treatment, and then usually physicians takes over. And this was my example, but there are many other examples when there is no supervision, and again, lacking the safety net for patient safety. And the idea with this educational and examining platform is that following a theoretical preparation and consultation with professor, the student will have an exam and will be presented with several cases to create his or her own treatment plan with the positioning of the laser spots and choosing energy, based on fluorescein angiogram or OCT thickness map. And once the professor feels that the student understands the principles of this treatment, will actually let the student or young physician go on to treat the actual patient. So unless, if the professor feels that the student is not ready, then more training will be needed. So again, we have the system can be a gatekeeper to who is ready for performing human treatments and who needs some additional treatment.
Thank you. We also received a further question. This is a little bit technical, so I would dare to answer that on my own. The question is, how many people can connect remotely at the same time? We have the ability to have 99 people for observation on the same device, but only one can access the device for remote planning. I hope you don't mind that I just quickly answered that one.
No, that's great, and thank you very much. And again, with the many rotating residents, you know, they can be placed at different rooms. We all remember from our training times and during medical school that for one patient there could be 6, 7 people in the room, which is not very comfortable for patient, and also very few will actually learn and see what the physician is doing. So this way, if we can place them in a different room or multiple rooms, we can teach multiple groups, and with this live image, you know, everything clearly seen on a monitor, you know, the settings, the energy, the location, and then execution of the treatment, you know, the laser uptake, you know, titration of energy. So all these can provide very valuable educational experience for many at the same time.
Very interesting. Thank you. Related to that question of how many people can be logged into that is the next question. It is, can this setup be used for probably larger scale laser courses?
Yeah, that definitely it can be used for educating, and again, there are various types of laser photocoagulation that we perform, and peripheral treatments are different from macular laser photocoagulation, and there needs to be a strategy in it. You know, in different pathologies, we are using different settings, and this all can be demonstrated and instructed. And this is a wonderful tool that can pool cases together. We can, during this course, the patient may be presented 20, 30 different cases and see a variety of photocoagulation patterns, which otherwise would take several weeks to obtain the same amount of experience. So absolutely, collecting cases using Navigate application, atlas of these collected cases, these all can prepare physician for the treatments.
Okay, thank you. I still see a few more questions that I think we might still have time to answer them. One is about, is there any specific software needed for remote invitees to be able to log into the system?
Well, it was shown in the video that the access is controlled. Basically, we need to have a laser instrument and then a reviewing software, and the communication includes sharing the access codes so that only authorized personnel is either allowed to see the treatment or is allowed to intervene in the treatment, as was seen in third module.
Yeah, so basically it will be probably when it's available coming with a system, but yes, it's a separate software for granting access. The one further question is about the actual process, if the treatment can be planned in advance.
Yes, so this is one of the advantages of this whole system, that it is image-based system. The images can be stored for later analysis or to be used for treatments, and let me give you an example. Some clinics, satellite clinics, that have retina patients but do not have a retina physician on a regular basis may use this system very efficiently. In my practice, I know many clinics who have general ophthalmologists or a refractive surgeon or a glaucoma specialist, but they get retina specialists once a week. So what can be done is that patient with retina problem can have their basic exam and imaging taken. These images are then transferred to retina specialists who can create treatment plans. And when he or she comes to do the retina clinic once a week, the patients can come back, for the expertise. By then, the treatment plans will be ready and everything is up and running for laser treatments itself.
Okay, thank you. I would love to add one sentence to that response. You always need a fundus image from Navilas to do the planning when you access remotely.
Correct.
That's just
yeah.
to specify a little bit more of what you just said. Well, there is one more question remaining. It's more related to the use of the whole Navilas itself. It's about the possibility to coagulate peripheral tears and holes without indenting, dulling the bulb, the eyeball.
Yeah. The system has unique ability to image retina in the periphery. The demonstrative cases actually show the mid-peripheral case, but we can actually reach out far in the retinal periphery and can safely treat any tears, any pathology related to thinning of the retina or impending pathology that could potentially result in retinal detachment, which we want to protect. Yes, the system can actually be used to treat far periphery. As a matter of fact, I understand that there is a system elaborated by French group which actually allows non-contact peripheral retinal photocoagulation, which is a fantastic addition. That you can do far out treatments without placing contact lens on patient's cornea.
Thank you very much. Basically, I have to say we have reached the end of our webinar. If I have not forgotten any questions, we have answered all questions. I would like to thank everybody, especially you, Dr. Kozak, for all the time and effort you invested into that webinar. I hope everyone enjoyed it and could take something out of this. If you'd like to have more information about navigated retinal laser, please refer to our website, there you will find a lot of cases, also explanations on how the retina navigation is functioning. The best link is also down here. It's www.od-os.com/experts.
Thank you, Ulrike. Thank you also organizers for this wonderful webinar and being part of this fascinating technology, which I do believe has a future in many fronts in ophthalmology.
And stay healthy.
Stay safe.
Thank you. Bye-bye.